Most people believe that heart attacks only happen to people who are clearly unhealthy. We imagine someone who smokes heavily, eats junk food every day, never exercises, and carries obvious risk factors like obesity or high blood pressure. So when we hear about a marathon runner, a gym enthusiast, or someone who looks completely fit suddenly suffering a heart attack, it feels shocking and confusing. The question immediately arises: how can someone who appears healthy experience something so serious? The truth is that heart attacks are far more complex than many people realize, and outward health does not always reflect what is happening inside the body. To understand why healthy people can have heart attacks, we first need to understand what a heart attack actually is. A heart attack, medically known as a myocardial infarction, occurs when blood flow to a portion of the heart muscle becomes blocked. The heart relies on a constant supply of oxygen-rich blood delivered through coronary arteries. When one of these arteries becomes blocked, the heart muscle in that area begins to suffer from a lack of oxygen. If the blockage persists long enough, that section of heart muscle can become damaged or even die. Most heart attacks are caused by a process called atherosclerosis, which is the buildup of fatty deposits known as plaques inside the walls of arteries. Over many years, cholesterol, inflammatory cells, calcium, and other substances accumulate along the inner lining of the blood vessels. These plaques can gradually narrow the arteries, restricting blood flow to the heart. However, the surprising part is that heart attacks do not always occur in people with the most obvious artery blockages. In fact, many heart attacks happen when a smaller plaque suddenly ruptures. When the plaque ruptures, the body tries to repair the damage by forming a blood clot. That clot can quickly grow large enough to completely block the artery, cutting off blood flow to the heart. This means that someone may have relatively mild narrowing of their arteries but still experience a heart attack if one of these unstable plaques ruptures unexpectedly. Another reason healthy people can experience heart attacks is because cardiovascular risk factors are not always visible. A person may look fit on the outside but still have underlying conditions that increase their risk. For example, high cholesterol can exist without any noticeable symptoms. Someone who exercises regularly and appears lean may still have elevated levels of LDL cholesterol, sometimes referred to as bad cholesterol, which contributes to plaque formation inside arteries. Genetics also play a powerful role in heart health. Some individuals inherit genetic variations that make them more prone to high cholesterol levels or abnormal lipid metabolism. One example is familial hypercholesterolemia, a genetic condition that causes extremely high cholesterol levels from a young age. People with this condition can develop significant artery plaque buildup even if they maintain a healthy lifestyle. Inflammation is another hidden factor that contributes to heart attacks. Chronic inflammation within the blood vessels can weaken plaques and make them more likely to rupture. Conditions such as autoimmune diseases, chronic stress, infections, and even poor sleep patterns can increase inflammation in the body. Stress itself is an important but often overlooked risk factor. When a person experiences intense stress, the body releases hormones such as adrenaline and cortisol. These hormones increase heart rate, raise blood pressure, and can cause blood vessels to constrict. In certain situations, extreme stress may trigger a heart attack by increasing the workload on the heart or destabilizing plaque within the arteries. There is even a phenomenon known as stress cardiomyopathy, sometimes called broken heart syndrome, where intense emotional stress temporarily weakens the heart muscle and mimics the symptoms of a heart attack. Another reason seemingly healthy individuals experience heart attacks is because traditional health markers do not tell the entire story. Many people focus on weight as a measure of health, but body weight alone does not fully capture cardiovascular risk. A person may have a normal body mass index while still carrying visceral fat, the type of fat that surrounds internal organs and contributes to metabolic dysfunction. Physical fitness also does not make someone immune to heart disease. While regular exercise significantly reduces risk, it cannot completely eliminate it. Some athletes develop coronary artery plaques due to genetic factors or long-term exposure to high levels of oxidative stress. In some cases, extreme endurance exercise may even contribute to changes in the heart and blood vessels. While this does not mean exercise is dangerous, it highlights that even high levels of fitness do not guarantee complete protection against cardiovascular events. Another hidden contributor to heart attacks is silent atherosclerosis. This refers to plaque buildup that progresses gradually without producing noticeable symptoms. Because coronary arteries can compensate for narrowing by expanding slightly, people may not experience chest pain or warning signs until a sudden plaque rupture occurs. For many individuals, the first indication of underlying heart disease is unfortunately the heart attack itself. Sleep is another factor that can influence heart attack risk even among otherwise healthy people. Poor sleep quality, sleep apnea, and chronic sleep deprivation can all contribute to elevated blood pressure, hormonal imbalances, and increased inflammation. Over time, these effects may increase the likelihood of cardiovascular events. Nutrition also plays a complex role. Someone who appears healthy may still consume a diet high in refined sugars, processed foods, or unhealthy fats. These dietary patterns can promote metabolic dysfunction and inflammation even in individuals who maintain a normal weight. Smoking is another factor that can dramatically increase heart attack risk. But even people who do not smoke may be exposed to secondhand smoke or environmental pollutants. Air pollution has been linked to increased cardiovascular risk due to its ability to trigger inflammation and oxidative stress within blood vessels. Age also plays a role in heart attacks occurring among people who appear healthy. As we age, the structure of blood vessels gradually changes. Arteries can become stiffer, and plaque accumulation becomes more likely over time. Even individuals who maintain healthy habits may eventually develop some degree of arterial plaque simply due to the natural aging process. Hormonal changes can also influence cardiovascular risk. For example, women often experience a rise in heart disease risk after menopause due to declining estrogen levels. Estrogen has protective effects on blood vessels, and when those levels drop, the risk of plaque buildup and artery stiffness may increase. Another important point is that symptoms of heart disease are not always obvious. Many people expect dramatic chest pain during a heart attack, but symptoms can sometimes be subtle. Some individuals experience mild chest discomfort, shortness of breath, fatigue, nausea, or pain in the jaw, neck, or arms. Because these symptoms can be mistaken for less serious conditions, people who consider themselves healthy may delay seeking medical attention. There are also rare but important causes of heart attacks that are unrelated to plaque buildup. One example is a coronary artery spasm, where a coronary artery suddenly tightens and temporarily blocks blood flow to the heart. Another condition, called spontaneous coronary artery dissection, occurs when a tear forms in the wall of a coronary artery, leading to reduced blood flow. These conditions can occur even in people without traditional cardiovascular risk factors. Despite these possibilities, it's important to remember that healthy habits still dramatically reduce the risk of heart disease. Regular exercise, balanced nutrition, maintaining healthy cholesterol levels, managing stress, and getting adequate sleep all contribute to protecting the heart for the long term. However, the existence of heart attacks in healthy individuals reminds us that health is multifaceted. What we see on the outside does not always reveal the internal state of our arteries and cardiovascular system. This is why preventive healthcare and regular medical checkups are so important. Blood tests, blood pressure monitoring, cholesterol screening, and imaging tests can sometimes identify risk factors before they lead to serious events. Modern medicine is improving our ability to assess cardiovascular risk. Advanced tests like coronary calcium scans can detect early plaque buildup in the arteries even before symptoms appear. By identifying risk early, individuals can take steps to reduce their chances of experiencing a heart attack. Ultimately, the reason healthy people sometimes have heart attacks comes down to a combination of hidden risk factors, genetics, inflammation, and the unpredictable nature of plaque rupture. The human body is complex, and cardiovascular disease develops over many years through interactions with lifestyle, biology, and environment. Understanding this complexity helps shift the conversation away from blame and towards awareness. A heart attack is not always the result of obvious unhealthy choices, and it can happen even in people who appear fit and active. What matters most is recognizing that health heart is an ongoing process. By paying attention to both visible habits and hidden risk factors, we can better protect ourselves and reduce the likelihood of unexpected cardiovascular events. And perhaps the most important takeaway is this: being healthy on the outside is valuable, but true health also requires understanding what is happening inside the body. Awareness, prevention, and regular care can make a powerful difference in protecting the heart for the long term.